Well, as you most likely know, the month of February is dedicated to raising awareness about heart health and encouraging us all to take steps daily to keep our tickers in good shape. Yet too often, people think heart disease is for those who are older. Yet the reality is heart failure is increasingly affecting younger populations. Dr. Peter Unkovic from Mount Carmel Health Systems is here to help us understand this alarming trend and really help us all do better. It is what we should all strive to do. So, Doctor, appreciate you being here.
Thank you, Robin. I appreciate the opportunity to be here with you this afternoon.
And let's talk about that first aspect too, right? Where some people think, hey, this is my grandparents. This is, the older generation. I don't have to worry about this. I'm young and healthy. Why are we seeing this increase in younger people now?
So there's multiple things that are playing into this. And you're right, this is traditionally a disease and a condition that people thought of was for older people.
Yeah.
But the reality is heart failure is a very broad term for lots of different heart conditions. And some of these do disproportionately affect our younger population.
Okay.
And different factors can affect this. One is we're starting to recognize things now that we didn't used to recognize. That because of that perception, there were things that were missed often in younger patients that were truly their heart at the base, but it was attributed to other things. And there have been other changes as well, in that we're seeing even people in their 30s and their 40s now being diagnosed with heart failure and cardiomyopathy, which is dysfunction of the heart muscle. And this can be coming from things largely being driven by lifestyle factors, a more sedentary lifestyle that a lot of people are living, decreased activity. And so all of these together are leading to this increasing diagnosis of heart failure in younger patients.
And is that something, the lifestyle factors, I know we often talk about those, are they the things that should simply be part of how we live, right? We should be active and eat right and kind of do all those things, not smoke. Those are the things you see that people aren't doing as much as they should, right?
Unfortunately, that's true.
Yeah.
That some of these are the things that maintaining a healthy weight, staying active, trying to get using the stairs more, staying active, exercising at least 150 minutes a week is what one of the guideline recommendations are. Controlling your blood pressure, and unfortunately rates of diabetes are spiking in younger populations, and this is driving some of this. Uncontrolled high blood pressure or hypertension is something else that's affecting and causing some of these changes that we're seeing.
And so, doctor, what are the congenital or even inherited conditions that you're seeing too that can lead to heart failure? Some people, and I think that's another factor, is that people didn't always ask their parents what they had or ask their grandparents their health history. What are some things we can be aware of in that regard?
Absolutely. So there are certain things called congenital heart conditions or defects that are conditions where there's a structural abnormality that's present from birth that doesn't always cause problems or symptoms immediately, but over time it can lead to some of these structural changes. And so sometimes that can be disorders of heart valves. So sometimes people can be born with an abnormal configuration in their heart valve. There could be some holes in the heart or abnormal communications for blood. There can be some disproportionate thickening of the heart muscle. There can be other genetic causes where some people are born where their muscle tissue is weaker, and it can cause the heart muscle to weaken and not be able to pump as hard. And so there can be things called cardiomyopathies. Hypertrophic cardiomyopathy is a name that a lot of people know, that we see that in the news, that can disproportionately affect some younger athletes.
Yes,
that's an abnormal thickening in the heart muscle. But you can also get what's called a dilated cardiomyopathy, which is a weakening of the heart muscle where the heart enlarges, in addition to some of these valve defects or these other heart congenital conditions.
Okay, well then let's get some warnings out there, some symptoms, something people can recognize, especially as a younger adult, that you might be writing off yourself, right? You might be saying,
Absolutely.
It can't be my heart. What are some of those things we should be looking out for?
Definitely. So some of the things that you should really think about is if you're noticing a substantial change, if you're starting to get a lot more short of breath, if you're starting to notice that things that you used to do without really thinking about, now maybe you're having to pause and take a break and catch your wind. If going up and down a flight of stairs, we're going to be getting into spring soon. If you're bringing things up from the basement, and if you're noticing that this is taking you longer, taking more out of you, maybe something is different, maybe something is changing, and this would be something to talk to your doctor about. And another thing would be getting your routine, checkups, because if you hear, people hear about heart murmurs, for example. That's a sound, but that can often underlie an underlying valve issue. And so maybe that's something that can be picked up, and early detection is key here. Swelling in the legs and the ankles is a common one. A little bit of subtle swelling is not abnormal at the end of the day, but if you're noticing a change in your weight and you haven't changed your diet or your lifestyle, if you're noticing a lot of swelling in the legs, in your abdomen, if your stomach is feeling bloated, these can be some of the things that we can see. Or also when people lay down, if they're feeling more short of breath,
Yeah.
This can be something that can often be a sign of maybe an underlying health condition that could be
be happening. Yeah. And I want to say, you've mentioned, kind of alluded to some of the things people can do, such as knowing their family history, right? Eating a heart healthy diet. Managing stress, I think, is one of those that gets, we all have stress, but I think finding other ways for people to actually take stake of that and like pay attention to that is probably a really important factor in heart health.
Absolutely. I mean, being your own advocate and taking care of yourself is important.
Yeah.
It's hard to take care of others if you don't take care of yourself. And you're right, knowing your family history is a very important one, because a lot of these things, as I mentioned earlier, can be genetic, especially in these younger populations. So talk to your parents, talk to your grandparents, and find out, has anybody had any sorts of conditions, or even, as we said, a lot of things didn't used to be known to be heart, but maybe if someone unexpectedly passed away at a young age, maybe that could have been a heart condition, because sometimes there can be heart rhythm conditions that are inherited that can be something that can cause heart disease and heart failure in young patients. And so, staying active, knowing your family history, taking care of yourself, controlling things like blood pressure, diabetes, your weight, managing your stress levels, getting enough sleep at nighttime, are all things that are going to really help you to, live your longest, healthiest life.
Exactly. All right. And we want to let people know, if you are diagnosed, if something happens, obviously treatments have come a long way. So talk with your doctor about that. Mount Carmel, too, has a St. Anne's cardiac walk-in clinic now. So Monday to Friday, 8 to 3:30, walk in there. A lot of people don't know if they should go to the emergency room, go to urgent care. It's a great resource right here in our community for anyone who is concerned. So, Doctor, appreciate you being here today.
Thank you so much. I really appreciate the opportunity to be here today.